Gray skin rip, find a honey dip to dip it in, slam dunk.
I don't have many.
The amazing, outstanding, demanding, commanding, you people dancing. That's a breath taker. I produce, aka the Undertaker. You wanna come down to the underground old school? Here's a shovel. Can you dig it, fool? Can you dig it? Can y'all dig it? 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 W-H-O-O-M-P as I flow to the flight from the school of bowl hardcore.
Good evening and welcome to the study session of the City Council of the City of Moreno Valley Community Services District, City as successor agency for the Community Redevelopment Agency of the City of Moreno Valley Housing Authority, Moreno Valley Public Finance Authority, Board of Library Trustees. The City Council receives a separate stipend for CSD meetings. I now call this meeting to order on November 14th, 2023 at 6 p.m. The Pledge of Allegiance will be led by myself. Please stand. Please repeat after me. Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands. Thank you. City Clerk, roll call, please.
Thank you, Mayor Pro Tem. Councilmember Baca Santa Cruz?
Here.
Councilmember Marcus?
Here.
Councilmember Bernard?
Here.
Mayor Pro Tem Delgado?
Here, ma'am.
And Mayor Cabrera is not present.
For the record, can we, I motion to excuse Mayor Cabrera from tonight's study session meeting. Can I get a second, please?
Because of a family emergency.
Because of a family emergency, thank you. So we have a motion and a second. Roll call,
Okay.
please.
Councilmember Baca Santa Cruz?
No.
Councilmember Marcus? Councilmember Bernard?
Yes.
Mayor Pro Tem Delgado?
Yes,
Okay.
and that motion passes. Thank you. Staff introductions, please.
Jane Halstead, City Clerk.
Patty Rodriguez, Senior Deputy City Clerk.
Stephen Quintanilla, City Attorney.
Mike Lee, City Manager.
Brian Mohan, Assistant City Manager, Administration.
Michael Lloyd, Assistant City Manager for Development.
Jeremy Bubnick, Parks and Community Services Director.
Ken Reichel, Chief of Police.
We knew that.
Patty E. Wheat, Parks and Community Services, PCS, Admin and Financial Services Division Manager. Sorry, it's a long title.
Thank you, Patty. And public comments on the matter of the agenda only. Pursuant to the Brown Act, public comment shall be limited to only those items on this study session agenda. Each person shall be allowed a total of 3 minutes to comment on each item on this study session agenda. Reminder, the city is currently offering Spanish translation services if anybody is interested. Finally, in order to preserve the meeting decorum, council and staff will not respond during public comments. City Clerk, are there any requests to speak tonight?
There are no requests to speak.
Thank you.
Thank you.
So the first item on the City Council study session we'll be discussing tonight is the Homeless Services Update, and that report will be given by the City Manager's Office. And Mr. Assistant City Manager, take it away.
Yes, thank you, Mayor Pro Tem, council members. To give you a bit of history, if you recall, back in February, we went ahead and did a homeless update as well. At that particular point in time, we went through and identified what the point in time count was, what the COC's responsibilities were that were required by HUD. We went through and looked at all of our services and programs and everything. So this is going to be a little bit scaled down, but there's going to be some additional services that have come to fruition based on relationships and collaboration with RUHS since that time. Plus, the point-in-time count has actually been issued, and so we'll be discussing that as well. So as we are going to be discussing the point-in-time count, again, I just wanted to reference that the county's point-in-time count, which is performed by the Continuum of Care, who is counted, who's not counted per HUD guidelines. So they look at sheltered, unsheltered places not meant for human habitation, and then sheltered emergency shelters and traditional housing for homeless. And the 23 point-in-time count yielded 77 homeless, unsheltered homeless at the time that their report was issued. Later, I believe it was April timeframe. So it shows that there were actually 56 homeless that were interviewed with 21 observational. If you could see, compared to 22, very, very much in line. And then if you recall in 21, there was no point in time count that was counted because of the pandemic. When you look at the 23 point in time count compared to some of our peers within the region, and you take a look at Hemet, Riverside, Banning, Temecula, Paris, and Moreno Valley, you're looking at numbers of 207, 605, 40, 35, 90, and 77 respectively. I think the more poignant number is when you look at the point in time count compared to the population of our residents. And so when you take the homeless count per 1,000 population and you look at the various factors at that particular point in time, Moreno Valley is still one of the lowest in our region, only second to Temecula at this particular point in time, with 0.3697. As you can see, some of the others surrounding areas in our region, 1.14, 1.28, 1.92, 2.3. So a lot of these particular jurisdictions actually saw some increases in homeless where we did not. Again, that goes to the services and collaboration and relationships that we have with some of the services that you're going to learn about tonight. As we're talking about the continuum of care, I wanted to just reiterate this particular slide where it shows the various funding for continuum of care, whether it come from HUD or ESG, some of the coronavirus funding that they were receiving as well. Housing Authority of the County of Riverside, and the Housing Community Development. So when you look in totality of what the county has to offer our region, you're looking at several millions of dollars, and about the tune of almost 400 million. Again, that's why we always say that we need regional partners and regional solutions for homeless in our region. When you look at Moreno Valley's homeless for our funding sources and for the average amount per homeless per the PIT count, obviously it fluctuates from year to year, and you kind of have anomalies in fiscal year 1920, 2021, and 21-22 due to the fact that in 1920 we had already started to receive a considerable amount of coronavirus or pandemic funding, 2.2 million there. And then even on the 21-22 side, we were still receiving quite a bit of the emergency rental assistance program funding. Even in 22-23, we still have a little bit of ERAP or emergency rental assistance program, but it's not that much. It's in the 600,000 range, so it's not going to skew the numbers when you really try and take a look at 22-23 back to 18-19 timeframe. So you can see from 15-16, that last column or the last row on the bottom, take a look at what the average amount per homeless is. 6,716 was in 15-16. Current year, or 22-23 year that we just wrapped up, was 14,481 per homeless. Again, we do have a homeless task force and the assistant team. Now this has all of the phone numbers that have been removed, but we do have the Salvation Army as our main partner. We do have our program administration, which is the Financial Resources Division, our park maintenance, our park rangers, community development such as community enhancement, the police department with the HOT team, and all of the various teams that potentially are available, which also includes CBAT. And then we have other resources regionally with Home Connect, RUHS, some veteran services, as well as TSA or the Salvation Army. And if you recall, in February, we also went through the various programs that were being funded through HUD entitlement and or the general fund. So Homeless Assistance Program and the Homeless to Work Program, if you recall, we recently removed that from the HUD entitlement process. which is very restrictive, has to be in certain tracts that are approved by HUD for disadvantaged neighborhoods. We move that to the general fund so that these particular programs can now be citywide. So homeless assistance program, homeless to work, the rapid rehousing program, the senior nutrition program with Family Services Association, the emergency shelter for youth, community betterment and problem-oriented policing with RSD, Safe Communities Project, the MOVAN for senior transportation program, which is a very highly used program for our senior centers, or for our seniors to our senior center. Court-appointed special advocate, the CASA program, anti-discrimination services, landlord-tenant counseling services, and then the homeless prevention with the Lutheran Social Services. Our flagship program is the Homeless to Work program, award-winning program for multiple years. Multiple organizations and agencies have provided us awards for this particular program, and you'll learn more about it and hear some metrics from Salvation Army. At this point, I would like to bring up Mark Davis from the Salvation Army. And he'll be able to give you a little bit more insight to their programs, which is the homeless assistance program, the homeless to work, the rapid rehousing, and then their mantra or methodology as to how they interact with our community and disadvantaged individuals. And then we'll have time for questions before we get into Riverside University Health Systems.
I just want to thank the City of Moreno Valley for having and partnering with the Salvation Army. It's been an honor for all your support that you've given the Salvation Army over the years of support itself. And thank you for inviting us today. I want to just kind of talk about the Salvation Army and the partnership that we currently have. And it's about relationships, first of all. And the individuals that we currently have, Michael and Vince, are building relationships every single day when they're out there in the field. Working with the homeless population. There's been individual Michael has been bitten by a dog, while he's been out there also. But he's dedicated to what he does every single day. The vision of the leadership, break the cycle of homeless and bring homeless people to self-sufficiency by restoring dignity and overcoming their addiction and challenges. When I talk about relationships, I'm going to talk about a young lady by the name of Lisa. I'm proud to say Lisa's 6 months clean. She's from Moreno Valley. You might remember her. She used to be by the PNC Bank, hanging out. People used to tell her to leave, but she got tired of being tired and said, I need to get off drugs. I need a place to stay. I need to be productive. And then we built a relationship with Lisa. Lisa decided to go to treatment. Lisa's part of the Homeless to Work program. Lisa's in a facility, living the American dream of doing what it takes to be able to be off the street and not be homeless and work, and be proud to be able to go to work. And that's because of the City of Moreno Valley that gave her that opportunity to be able to do that. Her next steps is looking for a full-time job, which we're working with. Providing the case management with which we are doing, and listening to the challenges, the issues that she might be having, and being able to help her and cope her through that whole process itself. Because the reality is, we can offer a job, we can offer a place to stay, but what is the root issue behind the person who's homeless today? And that's why it's important that we're building relationships today to be able to find out what those issues are. And that's what we're doing with Lisa. And I'm proud to say she's 6 months clean. Sorry. The Homeless to Work program. The goal of the program is twofold: to clean areas of the city, to make a happier, healthy place for all to live, to offer employment opportunities focused on building up lives and establishing long-term employment, housing, sustainability for our neighbors experiencing homeless. Like I said, this is about building relationships. This gentleman right here is Ken. Ken was staying under a tree. Didn't know exactly what he wanted to do. Michael and Vince building a relationship again. We were able to get Ken into an ARC. Unfortunately, he didn't cut the mustard with ARC. However, he knew that he wanted to be clean. He knew, so he came back, and we found another place for him to be able to go. Ken's now been clean for, Ken's now been clean for now 9 months. Ken's working 2 jobs and has a place to stay because of the city of Moreno Valley. I can't say enough. 2 jobs. He went from being homeless, now he has 2 jobs, saving money, just bought a car, and he's the happiest guy ever. Just bought a car. And this is great stuff. I can't make this up. I really, truly can't. I wish I could at times, but I can't, you know. Let's talk about stats. Our stats tell the story. When Michael and Vince are out in the field, they're reaching, as of today, 10,835 interactions with individuals that are homeless, that are struggling, that have mental health issues or addictions. 925 people we've referred over to health and addiction programs. What does that mean? We provided a place for them to go for the ARC for men and women that have some type of addiction. We've contacted RUHS, which helps us out with people who have mental health issues. 228 individuals have gone through the hiring process. This is remarkable. 139 people have completed the program, 90-day program. And we're moving into, for 2023-24, of about 130 people that we're going to process more additional, thanks to your funding that you're giving the Salvation Army to be able to help those individuals out. 84 moved on to housing and employment. There's a gentleman, I don't know if you know him, his name is Vince. Vince is 14 years clean today. Vince is a resident of Moreno Valley. He's a business owner, he's an employee of the Salvation Army, and he's also a philanthropist because he gives back. And he gives back because of the fact that at one point in time, he was sitting on the same corner with an addiction, trying to figure out what he was going to do next. But he turned his life around. Why? Because he believed in the Salvation Army, and he was able to build that relationship today. Opportunities that impact lives. 60% of our individuals who completed our program moved on to stable employment and housing. You might say, that's pretty high. That can't be. But all I have to say to you is, it's about building relationships, establishing trust, people knowing that you actually care. If someone's going to walk where you are and we're providing water to these individuals, having just a simple conversation of why did you end up in the place that you're in? What can we do to be able to help you? Establishing that type of relationship itself. That's why it's high, because we're doing something right. But we're also doing something right because we have the support of the city and the partnerships of law enforcement, code enforcement, RUHS. That's what we're doing something right. And we're able to do this because of that. We picked up over 44,000 pounds of trash and debris collected throughout the city, making Moreno Valley a cleaner and nicer place. A pathway to potential. Case management and counseling is provided during the initial 90 days of employment. A participant develops meaningful action plans that identify personal or professional barriers, creating solutions and motivates change. Why is that important? Because we have case managers that are being able to navigate some of the challenges and the issues that these individuals might be having, such as maybe they don't have an ID, maybe they don't have a social security card, maybe they might need some mental health issues, maybe they might have an addiction, maybe they don't have a job, maybe they have a learning disability. But these case managers are figuring those things out to be able to help people out, to be able to make it so they are going to be successful again and give them a second opportunity to be able to be successful. All meaningful work and progress is made in the community. It's here that an individual receives the support and strength and renewed self-worth and dignity that truly transform lives. Mariella, she was a former addict. She ended up having a child and was pregnant in the field. She decided to change her life, took college courses, plugged in at the Salvation Army, and took college courses because she wanted to change her life. And because we built that relationship with her so that she knew that this was a safe place for her to be able to go so that she can change her life. She graduated. She works in the medical field. She's a full-time mom, housed and employed. That's what I'm talking about. That's making a difference. Our strategies offer strength, 50 to 60 interactions per week. What does that mean? Michael is able to get out there in the field, and Vince is able to get out there in the field and have meaningful conversations with individuals to find out exactly what they need. How can we help? It can be as small as a bottle of water, a blanket. It can be as easy as I need a ride to the courthouse, because we've done that before. Serves as a conduit between the individuals and services. Coordinates with task force, that's what it should say, with code enforcement, PD, city, county of Riverside, outreach workers, and RUHS. We're all working together. We're all working together to be able to make a difference and make an impact and make sure that this city continues to thrive the way it's always been thriving. An average of 1 to 2 individuals exit homeless every week. That's through the success of Michael and Vince and the Salvation Army and the city partnerships and the city being together and working hard together to be able to make sure that we're helping the people that need to be helped. Michael today is 15 years clean. And then January 4th, he'll be 16 years clean. We take people to the ARC in Paris. We take people to the ARC out in Orange County. We take them wherever they need to be able to provide the help that they need. Should have brought water. A home equals hope. 51 people permanently housed. 35 households accessed emergency hotels. 45 households were in the homeless prevention program. What does that mean? The People's family. His wife passed away from cancer. His daughter is 15 years of age. Can you imagine losing your parent at 15 years of age and not being able to understand why or what's going on? Both mom and dad were working. Mom gets cancer. Dad's the only one working now. Loss of income. Dad gets hurt. Dad loses his income. Now he's on disability. More loss of income. Now they're homeless, living in the city of Moreno Valley in their car. Again, the 15-year-old daughter is wondering, how did this happen to us? How did this happen to me? Where's my mom? Dad's doing the best that he can. But then he found out about the funds that were to support housing through Moreno Valley. and he came to us, the Salvation Army, to be able to provide a hotel for them and be able to help stabilize them and also look for housing that they can afford. And we were able to find that through the support of the city of Moreno Valley and the support of the Salvation Army. They're thriving. Dad is back to work. He's doing well. And he thanks the Salvation Army, and he also thanks the city of Moreno Valley as well. We often talk about gateways. And the reason why we say gateways is because people come to us for food assistance, emergency shelter, homeless outreach, and showers for homeless individuals. And that's just a gateway. But then there's growth points. And the growth points is once we get people to come into us, the growth points is offering rehabilitation for individuals, case management, homeless to work, and community support for those individuals who might need that. And then once they've gone through the growth points, it's a give back by offering purpose teams, community integration, housing, stability, and long-term support through the Salvation Army itself. Our goal, transforming lives one story at a time. Lasting change through our strategy and strength of partnerships, we aim to create lasting change in addressing the issues of homelessness in Moreno Valley. Thank you very much. Any questions?
Well, I don't have a question, but I have a comment. One of the reoccurring themes that all these people that accepted your help or our help, what they have in common is they wanted to do it. They have a desire to get better. So every time that you said Michael and Lisa came to the program because they wanted to change. They were tired of being tired. So I think the message here is that if you want help, there's resources out there. There's 77 on the last PIT, 77 in the city of Moreno Valley. I think we have the resources and the folks, you guys, and the city and other areas and other nonprofits in the city that if those 77 really wanted help, then there's resources out there for them. So thank you very much.
Thank you.
I have a few questions. So one question that I have is how much is the cost per person in the program?
I'd have to get back to you on that. I'm not quite sure. I didn't bring that number with me today.
Another question I have is how many people are enrolled versus how many people complete the program? Because I see a 60% success rate, but I don't know what that's the measured number against.
That's a great question. So if you look at the 228 through the hiring process and you divide the 139, that's where you get the 60%.
That's where you guys are getting that from?
Yes.
Okay. And then is it safe to say that your program is mainly focused on people that are suffering from addiction or mental health that are actually homeless living out in the fields, not necessarily people that are working homeless?
It is safe to say that we are available to help anyone that needs the help themselves that are homeless or potentially homeless, that may have addiction or they may have mental health issues. But if they need the help, we're willing to provide that.
And then we did hear that you help people find housing that's affordable. So when you say you find housing that's affordable, are we providing first and last month's rent for them? Is that what you mean with trying? Because most places require first and last month's rent.
So through the grant funding itself, it allowed us to pay up to the deposit in 6 months of rent altogether. And so we were able to help pay first, last, and the deposit.
Okay. And then what is the actual overhead for administration and staff?
So the overhead is at 25% itself. And again, I wouldn't have an exact number, but it's at 25%. I can provide that for you at some point.
So it's at 25%, and the rest of it, the other 75%, all goes to the actual individuals that you're helping?
That's correct.
And then, so if someone were to come to you and they needed a voucher, how long are your vouchers typically lasting for?
The grant allowed us to pay up to 90 days of the for a motel voucher itself at that particular time. The challenge, though, with that particular grant is individuals literally had to have some type of income, and one of the challenges is that rent in the city of Moreno Valley is pretty high. So that was a challenge itself, and their income ratio had to be there to be able to get a place to live in Moreno Valley itself.
Thank you.
Not a problem. Any other questions?
On one of the slides, it said that one of the participants had been receiving housing for a year and then that she was sober for 6 months. So is it not a requirement for them to be in treatment when they're in the housing?
So that particular person was in I want to say a halfway house or whatever the case it is, but they were in a facility at the time, and then we provided housing for them.
Oh, so we're counting the facility. Is that like a rehab facility?
I forgot what the name of it. They have to pay rent to be able to stay there. They've already went to a rehab and now they're paying rent to be able to stay there. A transitional living, sorry, thank you. Transitional living house itself. So they have to pay rent to be able to stay there.
Thank you.
Thanks for the presentation. Very informative. I've got 2 questions. Sure. Out of these 7, and it looks like it's last year and this year's counts, how many of those are transit homeless people coming through the city? Or how do you know the transit?
So when we do our PIT counts, we have someone going monthly to be able to count those individuals in the city of Moreno Valley, and they are counting the tents and the individuals in the city of Moreno Valley itself, and so that's how we know that they are transient itself in the city of Moreno Valley.
And the next question is military vets. Are we giving them special treatment when it comes to what we're talking about, homeless, drug addiction? Are we giving them special treatment, meaning take them down to the VA hospital or down to the apartments?
Absolutely. We have taken individuals to the VA or to the apartments themselves. We've actually had case managers that have called over there if they've had challenges reaching someone, and have sat with them in meetings to be able to make sure that they are going to be successful.
And does the government help, federal government helps or supports you guys or any type of funding?
The Salvation Army gets funding from many different sources, government, individuals, and grants itself.
Okay, that's it. Thank you.
So Mayor Pro Tem, council members, if I might add, so there were several questions and so forth. So any one question may be answered in many different ways depending on the actual funding source and the program itself. So if you recall, the Homeless Assistance Program is a separate program than the Homeless to Work Program. That's a separate program than the Rapid Rehousing Program. All of them have different funding sources and different requirements. The Rapid Rehousing Program that Mark was talking about is actually a grant. And that although we received the grant, we were contracting with the subrecipient, TSA, to perform that particular grant. And that's where the 40 families and the rapid rehousing requirements came into play. So at any given time, depending on the specificity of your question and the program you're talking about, overheads could be a little bit different based on granting guidelines and or our programs that are through the general fund for the homeless assistance and the homeless to work, as well as the nice thing about this particular collaboration is Salvation Army is also in touch and in tune with the COC, the Continuum of Care, other regional partners and funding sources. So if for some reason you were ever contacted by one of your constituents and there was a need, we can call Salvation Army. And if it doesn't necessarily fit in any of the 3 programs that we do business with TSA specifically, there's other programs that they have, other funding sources that they get, that they're able to still be able to provide some type of service to an individual who wants that service. And so that is the greater good of our partnership in collaboration with the Salvation Army.
Mayor Pro
Thank
Tem,
you, Brian.
I got one
One more comment?
Do you guys go on the freeways or just the city limits?
Just the city limits itself.
So what we see on the freeways, it's basically the state's problem, correct?
That would be correct, yes.
And I've heard that we used to kick them out of the city and have them go on the freeway, but I think that's just a myth. I don't think that's actually true, but
That would be a liability.
yeah, that's understandable. But I've heard that it seems like we kick them out of the city, they go onto the freeways because state, you know how the state reacts or their time.
The one thing that you did ask about is transient. And so depending on anything that the state may be doing in announcements of free healthcare, we do see upticks with people migrating through our city that have been from out of state and in the past. So as we were in the pandemic, although there was not a continuum of care point in time count because of the pandemic, we were seeing some migratory individuals that were from out of state who were here to be able to get free health care.
Any more questions from the dais?
Just one more. So how many people are actually employed by the Salvation Army on your staff?
How many people are employed with
Yeah,
this?
that 25%, how many people are actually on staff for the Salvation Army?
See, I've got to count in my head. Give me a quick minute here.
Go ahead.
Percentages. 1, 2, 3. It's about 5. And there's also some in-kind in there as well, because it does cost the Salvation Army funds to be able to do the program itself.
So you guys have 5 actual staff members that are considered full-time?
Yes, ma'am.
Okay. And then you said everybody else, you have other people that volunteer or do services in kind?
Yes, ma'am.
Okay. Okay. Thank you.
Anybody else? Mark, thank you very much.
Thank you
for coming up.
Thanks.
So what are the challenges for homelessness going forward? Reduce the number of families below poverty. So if you recall, recently through the Economic Development Department, there was some new figures that were released. And so with the rise of household income from roughly the mid-60s to 96,000 over the last 7 years, our poverty rate has reduced to 10.79%. But the biggest thing that we're seeing is the mental health issues and the drug addiction or chemical dependency. So addressing those particular services, in which you're going to hear in a presentation from RUHS as our new partner, and the wonderful things that they're doing. Job opportunities for felons. So as part of the partnership of Homeless to Work, we were partnering with Waste Management. We also, through Economic Development Department, reached out to some of our other manufacturing, industrial type of jobs that were available. And in working with those particular employers, we found out that they are felon friendly. And we were able to place several of those individuals with other employers. And then again, going back to the regional solutions, really looking at the continuum of care with all of the various funding that they get, trying to come up with a regional solution for homelessness with really having a homeless shelter in the western Riverside County, and that would be funded by Continuum of Care, as they're the ones that receive the most money. And then the most recent service that just was implemented by the state is Care Court, and you'll hear a little bit about that tonight from the RUHS. folks. So we'll go ahead and now switch it over to the other presentation, and RUHS will come up and be able to present for you on that one.
Does anybody have any questions for Brian at this point?
Thank you.
Thank you, Brian.
Good evening. Thank you so much for having us here tonight to share about some of our programs through the county. I'm here to talk to you a little bit about our crisis support system of care. I'm Kristen Miller. I'm an administrator over our program. So first, I'll share with you information about our mobile crisis response teams. Our mobile crisis response teams started back in 2014. These teams were initially established through some grant funding that allowed us to have stakeholders such as law enforcement and emergency departments. So initially, our services were really only available for those two stakeholders, and you may have heard the terms CREST and REACH. Those were the names of our programs back in 2014. Those funds also helped us establish our mental health urgent cares. So now we have just mobile crisis response. We no longer go by the names of CREST and REACH, although they seem to be a bit of pillars in the community. People still use those names quite frequently. But we didn't want folks to have to figure out which team to request or which team to ask for, and so we just are mobile crisis response teams. And now we're available to all stakeholders and the community. And so what mobile crisis response teams are, they're fully field-based teams that are available to respond to people who are in crisis. And those teams consist of clinical therapists, behavioral health specialists, and peer support specialists, and these are our traditional teams. So they are fully equipped with what they need to do to serve people completely in crisis in the field. Some of our goals, our first and foremost goal is obviously we want to support folks who are in a crisis. We don't want people suffering. We want to get there as quickly as possible, and we want to provide that immediate support. We also want to try to reduce unnecessary law enforcement contact, reduce some of that burden on our law enforcement folks, partners. Also reduce some of the burden to emergency departments. You may know we frequently say if you're in a crisis, call 911 or go to emergency room. And that makes sense if you're in a medical crisis. It doesn't always make sense if you're in a mental health or psychiatric crisis. So we're trying to undo that a little bit. And calling 911 or going to emergency room may not be what you need. You might need a mobile crisis response team. And so we're trying again to reduce some of that burden on those systems. We also want to reduce the number of unnecessary 5150s. So because our teams are able to come out and spend the time necessary to really de-escalate and just support folks who are experiencing a crisis, we can often divert away from a hospitalization, divert away from a 5150 if it's not necessary. Our teams are trained to use the least restrictive treatment services available. So our goal is really to divert away from higher levels of care and help people stay safe in the community. And so the other piece I like to mention is we really train our teams to be resource experts. Often we find that the community is really unaware of what's available to them in the community, and so our teams are versed with what they can connect and link folks to. So we are currently available 7 days a week from the hours of 8 a.m. to 8 p.m. We're not currently working county holidays, although due to a new mobile crisis benefit through the state, starting December 31st, 2023, we'll have mobile crisis services available 24 hours a day, 365 days a year. So who we serve, our motto is anyone, anywhere, and come December 31st, it'll be any time. We really broadly define crisis. We define that as anything that really shouldn't or can't be scheduled at a future date. It's really up to the person who is experiencing some sort of dysregulation. So for example, we may have a kiddo at a school who received a bad grade and is in a very upset state. They're dysregulated, they're not managing their behavior well, and so we're going to go out on that. We're going to go out and see what we can do to help de-escalate that situation, help that kiddo regulate better, and maybe get connected to some services to learn a little bit more about how to cope with things that are distressing. versus we might get a call for someone who's in a very acute episode of psychosis and is engaging in very dangerous behaviors to themselves or others, or really unable to care for themselves. So it's a huge contingency of who we see. We also serve, again, anyone regardless of insurance, any age, and anywhere that is safe for our teams to go. We have a call center, and how teams are dispatched is through that call center. So we have our 951-686 HELP and 988 that are public-facing numbers for the community to call if they need a crisis response. And additionally, our stakeholders have an 888 number that they call us directly on. So law enforcement, schools, APS, CPS, Moreno Valley City. If you need a crisis team, then you call that number. You'll get in touch with one of our behavioral health specialists who will take very quick, brief information from you, because again, our goal is to get out there and respond as quickly as possible. And so our dispatch team, our call center staff, they're going to triage that call, make sure that it's safe for the team to respond, gather necessary information, and then they're going to dispatch out the team. The staff that's dispatched out will then call the person with an ETA on their arrival time. So for example, if one of the local Moreno Valley schools call, then as soon as the team's dispatched, that team will call the requester and say, okay, we'll be there in 15 minutes. Our goal is to be on location in less than 30 minutes. We are county-wide. We serve all the way from Riverside to Blythe. Our recent data told us that our average response time is 45. So we have a little work to do to get to that 30-minute mark, but we're working on it. So once our teams are on scene, they just need an introduction to who's in crisis by whoever that stakeholder is that called. And then they're going to build rapid rapport, and they're going to really do everything they can to come up with a strong safety plan. Hopefully that safety plan will include staying in the community. They're going to do a thorough risk assessment. They'll assess those risk factors. They'll assess those protective factors. And then they will make a decision clinically about what they think is necessary for that individual to be safe. They'll develop, like I mentioned, a thorough safety plan. One of the things our teams do is they consult with a licensed clinician on every single call. So every single call that they're dispatched out on, they're going to consult with, it's usually a supervisor, but sometimes some of our senior clinical therapists that have been licensed for a while will be their consultant. And the goal of that is to really make sure that they're seeing the whole big picture. They have a strong safety plan, but it's also to remind the teams of different resources that are available, and also to provide support for that team. As you can imagine, being in that emotional realm with someone who's in crisis, that extra layer of consultation helps ensure that the teams are objective and can really make sure that people are getting the strong safety plan in place that they need. So some of the ways that we develop safety plans are by using natural supports. We can call family members, we can call neighbors, pastors, really whatever it's going to take to help that person feel more comfortable, to feel supported. And again, the goal is to stay safe in the community. If that's not an option, then some of the things we can do is help someone get to one of our mental health urgent cares, which I'll mention in a couple slides, as well as go to a hospitalization if necessary. And they can go voluntarily and our team can help them get there. Or if they're not willing or able to go and they really are not in a safe place, then our teams can initiate a 5150. In addition to that crisis response, we also have a follow-up component to that program, and that is within 72 hours, we are going to follow up, do everything we can to follow up with folks that we recently saw. And again, that whole point of that follow-up is to see what services they need help with, if they need help navigating our system of care and getting connected and linked to ongoing services, to remind them that those services are important. Often folks who are in crisis will kind of sweep it under the carpet once it's resolved and forget that getting that ongoing support and care can help prevent future crisis. So we're there to remind them. Most of that follow-up is done via phone. However, those teams can do some in-person follow-up. The next type of team I'll mention is our mobile crisis management team. That's the team that we have, I think, pretty connected well here in the city of Moreno Valley. And that type of team is the same as everything I just mentioned with our response teams. But in addition to that, they're staffed a little bit differently so they can provide more like wraparound type services. So they have a substance use counselor on the team, a peer support specialist on the team, case manager, and a clinical therapist. And then again, they do all the mobile crisis response. But in addition to that, they'll do intensive case management for a short-term period of time to get people stable and connected to services. When they're not doing the crisis response or the case management, they will also do some outreach. So we've partnered and gone out on some of the homeless task force meetings here in the city of Moreno Valley. I got to go one time. It was really good. And we'll stand by, and if somebody is in a crisis or wanting maybe some services, willing to talk about substance use, then the team's on standby and they're right there ready to support that individual in getting connected. This is that outreach that I just mentioned that we'll do. These are the locations. We currently have teams. We have a total staff of 8. Right now it's 6. We have 2 people who are onboarding in the next month to join the Moreno Valley team. So it's a total staff, when it's fully staffed, of 8 folks who will be serving the Moreno Valley community. For the mobile crisis management team, you also have the mobile crisis response team. We do some community support and outreach. And then you also here in the city of Moreno Valley have CBAT that was mentioned earlier. That's also under our crisis support system of care. So CBAT, as you may know, is a specialized unit. It consists of a clinical therapist who's partnered with a sheriff's deputy. And CBAT really functions as that first or second responder. Their goal is to do rapid response. They're going to respond to 911 calls that are behavioral health or substance use crisis in nature. Their goal is very similar to our mobile crisis response teams, and now again we're trying to divert away from all those things I mentioned earlier and try to help folks stay safe in the community. And as a last resort, we will help folks get hospitalized. We're also trying to prevent unnecessary arrests, if at all possible. If someone does need to be arrested and they have behavioral health or substance use concerns, then that team does a pretty good job at connecting with detention services and helping folks get assessed and the services they need. So those are the goals of CBAT, which I mentioned earlier. Diversion, it's all diversion, diversion, diversion as much as possible. Also linking to care. That's another one of the big goals. I know I mentioned it earlier, but that's a big piece of what we're trying to do is really get people connected to ongoing services. So if they are finding themselves entering into a crisis, they're able to access that provider and maybe not need to call 911, not need to go to the emergency room. So we started very small with our CBAT locations. We only had 3 teams, and I'm happy to say we now have 17 throughout the county. So we have a lot of collaborative partnerships out there making a really big difference. Last, I'll mention just very briefly, because it does pertain to Moreno Valley, is that we have a grant called Behavioral Health Justice Intervention Services. And this is to place 7 clinicians on different college campuses. And one of those college campuses is RCC Moreno Valley. And so this will allow for us to provide some crisis support to students or faculty or anybody within that the Moreno Valley campus who might need some crisis support. So we are working on staffing the position here for the Moreno Valley campus. We have a person who's onboarded. We're just doing their training, and we'll get them launched out on that campus pretty soon. And so one of the ways we do that is we partner either with the campus security or RCC PD and can respond to folks in crisis, all again with the goal in mind of trying to divert folks away from unnecessary arrests or hospitalizations. Lastly, I'll mention our mental health urgent cares. So these are crisis receiving facilities that are available 24 hours a day, 7 days a week. And so if someone needs more care than what a mobile crisis response team can provide, some services like maybe medication, they're able to go to a mental health urgent care and get those services right away. They can stay there for up to 23 hours. And 50% of the staffing at our mental health urgent cares are peer support specialists. This is a flyer. Whoops. And on the slides is contact information for our department. I did bring just a few statistics for Moreno Valley related to our response that I wanted to share with you all. This is for our last fiscal year. Hopefully I can find it. And of course it's not here. Well, I can remember off the top of my head, we had a total of 857 crisis responses for the city of Moreno Valley. I have a breakdown on how many of those are for schools and how many of those are for the community. I'm happy to share that. I can email that over to you, Brian. I apologize, I had it in my packet and I'm not quite sure what I did. Oh, it's right there. We did have a total of 857 total requests. 194 of those were for our mobile crisis response team. 231 were those the mobile crisis management team, the team that does more of the intensive case management. 432 of those were our CBAT team responding to. 153 of those requests were at schools. And we had a good amount of outreach. We had 17 homeless outreach, 99 mobile crisis management team contacts that weren't crisis related. So those were initiated by the team to the community to try to help folks get connected to care. So I'm happy to answer any questions if you all have any.
So just as a point of reference, this completes this particular point of the presentation, but there will be another RUHS representative come up to talk about Care Court. So if you have any questions about the mobile crisis team, this would be the time.
Do you anticipate another CBAT clinician coming to Moreno Valley?
I have heard, yes, I'm hopeful. I'm very hopeful that that will happen in the near future.
I know you're on record tonight, right?
Being hopeful. I'm on record being hopeful.
So just some additional information there. We do have 3 budgeted CBAT teams that currently have been approved by council.
Yes, that's
We have 1 deployed. The other deputies are available, which just linking the clinician to them. But this relationship has been a godsend because we're able to, in essence, take a look at the RUHS mobile crisis team as additional CBATs. And so that's why we've had such great response. Now it's just getting them actually hired through the recruiting process and dedicated to Moreno Valley.
She's hopeful.
I am. All right,
Thank you, Kristen.
Thank you so much.
Good evening, Mayor Pro Tem, council members, and staff. My name is Marcus Cannon, and I am the Deputy Director for our department overseeing our forensic programs. And I appreciate the chance to tell you a little bit about Care Court. As you may know, Care Court has gotten a fair amount of media coverage, and so I know a lot of people have a fair amount of familiarity with it, but hopefully tonight we can confirm some of what's true as well as dispel some common myths about Care Court. Care Court is a civil court process designed to connect individuals with certain mental health diagnoses over a 1 to 2 year process with county behavioral health services under the oversight of the judge. One of several things that Care Court is not is it's not a criminal court. It's not a solution for all mental health conditions, and it is not a solution to homelessness. Homelessness is not a criteria or a requirement to participate in Care Court, though you can be homeless and participate in Care Court. You must be 18 years of age or older. You have to have a severe mental illness, and you have to have schizophrenia or another psychotic disorder. You also have to not be clinically stable in ongoing treatment, or in other words, I think we'll see this on a future slide, but there's also a requirement for people to be languishing, which is to say they're not taking good care of themselves. Here you can see that in more detail, that the person needs to be unlikely to survive safely in the community, their condition is substantially deteriorating, or they're in need of services and supports to prevent a relapse or deterioration that would likely result in grave disability or serious harm to themselves or others. It also needs to be true that care court needs to be the least restrictive option for this person, and they need to be likely to benefit from it. Again, who is care court not for? People with a diagnosis of something other than schizophrenia or other psychotic disorders. For example, someone might have psychosis where they see and hear things that the rest of us don't see and hear. That could be the result of a traumatic brain injury, autism, dementia, or a substance use disorder. Care court is not for those groups. Individuals who are already linked and stable in treatment, care court is not for those individuals. And then someone who's not at risk of relapse or grave disability. Who are the parties involved in care court? There's the petitioner. This would be the person who would file a petition with the court to say to the court, I'm concerned about this person that I have a close relationship with, and I want the court to order that person to participate in behavioral health treatment. That's the petitioner. The respondent is the individual, the client, the subject of the petition. Obviously, there's a court and a judge who oversees these proceedings. Bless you. The County Behavioral Health Agency provides the investigation, the report, and the treatment throughout the care court process. Individuals who are respondents in the care court process are entitled to counsel. If they cannot provide their own counsel, the Riverside County Public Defender's Office will serve as counsel. And then lastly, county counsel assists behavioral health and or any other county department that's called into the proceedings. As we mentioned on the previous slide, the process starts with a qualified petitioner. We did not list all the petitioner types on this slide, but one thing that's unique about care court as opposed to other previous programs like this is that that range of petitioners has been widened. So immediate family members, spouse, parent, child, brother, sister, etc. Roommates qualify as a petitioner. Law enforcement officers, peace officers, emergency medical technicians, and other first responders are qualified petitioners, as well as behavioral health professionals are qualified petitioners. The person who is not a qualified petitioner is essentially the passerby. You cannot go to the court and say, I saw someone sleeping behind Walmart, I want you to order them into mental health care. There has to be this close, either personal or professional relationship to the respondent. The petitioner has to fill out that petition, and the petition requires certain documentation to establish that the person meets the criteria or appears to meet the criteria for care court. They file that petition with the court. The Riverside County Superior Court Self-Help Services has a phone number as well as a dedicated web page for care court information. Likewise, RUHS has a care court web page that provides information about our services as well as a redirect to that Superior Court Self-Help branch. They being the court self-help branch, do exist to help individuals navigate through that petition process. The court initially reviews that petition for completeness and would refer it to us, County Behavioral Health. We would be ordered to go out and meet with this respondent to complete a report back to the court to make an initial recommendation of whether it appears that the person does or does not meet the full criteria for care court. And then lastly, as part of that, we notify the respondent themselves that they're ordered to appear in court, but we would also notify the petitioner and the public defender to help ensure that that person has representation. I apologize for the redundancy, but here we did list out, you can see a number of the different people that can be a petitioner in detail. If there's sufficient evidence, I touched on this, but if there's sufficient evidence in that initial proceeding, the court will order us to respond within 14 days. So one feature of care court that's unique, part of its design is to put a sense of urgency on the courts and county behavioral health to move swiftly through this process. This is some of the information about how to find more information. Obviously, we have a website that provides our own information. There's FAQ documents in English and in Spanish. There's brief explanatory videos in English and Spanish, sort of the layperson's guide to care court. We also have advertised here our department's access line. The name is just coincidental that it's the same name. We've had the access line for a couple decades. What we hope for people is to get engaged in care voluntarily. The last thing we want is for people to have to go through a court process if they don't need to. And so many of the calls that we've received thus far, when callers reach out, they may not even know what services are available through the behavioral health department. And so we've been able to link a lot of people directly to voluntary care without a court process. But staff are trained to help do a screening when people call so that they can determine, A, is voluntary care an appropriate option and an option that that caller is looking for? B, does the person on face value appear to meet the criteria? And then C, they would connect with our court dedicated team to help guide people more specifically through the process. As well, I mentioned the how to file a petition. Superior Court self-help services are here. To say a little bit more about the process, assuming that an individual is ordered into the care court proceedings, if behavioral health returns a report to the court and says this person appears to meet criteria, the court can rule on that at that time, or they can set a hearing on the merits out 7 days. Either way, at that hearing on the merits, they will make a ruling to rule the person, order the person in, or to dismiss the case. Assuming that the person is ordered into care court, the behavioral health department is ordered again to go and complete a plan of care with this individual, care plan, treatment plan, and to respond back within 14 days. At the time that we respond, there's really two scenarios. That the respondent, the individual, can say, I agree with that, I think that would help me, and the court will record it as what they call a care agreement. If the person fails to appear or does not agree, the court can order it, and then the nomenclature is a care plan. But for all intents and purposes, the plan would include the same items. We're going to include the types of treatments and therapies that people need, medication, counseling, supportive services. If someone is homeless, then housing would be part of that plan. If a person is in need of connection to health insurance or other social benefits, CalFresh, Medi-Cal, connections to employment, other social benefits, staff would write that in as part of the care plan to help bring stability to this individual. After that care plan is ordered, there is a follow-up hearing every 60 days or at the discretion of the judge, which could be more often than 60 days. And then at 11 months, there's a status review hearing to determine if the judge intends to have this person graduate at that 1 year mark or wishes to order a second year. The person can also elect and voluntarily say, Your Honor, this program has helped me and I'd like to stay in for that second year, and the judge will continue that or consider that. The goal, of course, again, is to connect people into voluntary care. A couple of the misconceptions that are out there commonly is a misconception around homelessness, that is exclusively who this is for, which I shared is not true. You don't have to be homeless to participate in care court. I think another misconception is that anyone or everyone qualifies for care court, but it's actually a very narrow slice based on that diagnosis. And then I think one of the last common misconceptions is there's a belief that medications can be forced on people through the care court process. The judge can order someone to follow the care plan, which could include taking medication, but if that person refuses to comply, there are not civil or criminal penalties for failing to comply. So it's an expectation from the court that that person comply, but there is not an involuntary component. Someone is not going to hold someone down and administer medication against their will. And so I think that's a common misconception or an area that's important to clarify about the program. For RUHS specifically, we are up and running. We're having court hearings regularly. We've had 17 formal petitions come from the court at this point. We started October 2nd. We are staffing 2 initial teams to handle those cases. One that's located in Riverside, but will cover the western half of the county, and then another team that's located in Indio to cover the eastern half of the county. Over time, as volume grows, we may need to expand staffing to meet the need. I think those are the highlights. I know we were asked to keep it short, so I hope I did not go on too long, but I'm happy to answer any questions that the council has.
I have a couple questions before I turn it over to my peers here. This process is extremely complex.
Yes, sir.
So you said you had 17. How many out of those 17 are from Moreno Valley? Do you know?
I do not know at this time.
You have an are they? Are there any from Moreno Valley? Or?
Well, Councilmember, obviously the city wouldn't know because they're confidential pieces of information. The reason why we wanted to bring this forward to you tonight was, one, the collaboration with RUHS and the mobile crisis team, but it was perfect timing on Care Court because on social media, almost as soon as the press release went out, social media was, oh, there's 40 people that are already in care and hope they have homelessness attached to it and housing, so when these individuals go through the program. So we wanted to have this go through the proper channels, provide the information so that our residents are informed, and hopefully on social media land, they're able to calm down as to what truly is occurring. And quite frankly, no one will ever find out who or where they're from as part of the Care Court. Those are confidential documents. If they show up on the court's doc, then that's fine. That's public information, whatever they're putting out. The city will never inquire as to who is part of Care Court.
Thank you. And then my last question is, what if they don't agree to it? You said as they go through the court process and they're talking to the judge and the judge says, you know, this is what I want you to do, and they're like, no. What are their consequences, or are there any consequences?
I would say in the statute, there's no consequence in terms of civil or criminal penalty. So they're not held in contempt of court or fined or jailed. The one thing that you could call a consequence in the law is there's a section that says that if someone fails Care Court, fail is not defined specifically, but assuming that the judge determines them to be a failure in the process, the judge can order the county public guardian's office to conduct an investigation for conservatorship. The person still has to meet the Lanterman-Petra Short LPS criteria in the law. So failing doesn't change those criteria, but there is an accountability on the public guardian's office to conduct an investigation. I think that would be the extent to which you could say that there's a stick in the law.
And it gets more complex.
Yes, sir.
Thank you.
Certainly appreciate the complexity, happy to help however we can in that process, but not a simple matter.
Questions from the dais?
So you just said that if someone fails to complete Care Court, one consequence is the public guardianship. Public guardians can get involved and possibly take conservatorship of the individual if they deem it necessary, like they're unable to care for themselves.
Yeah, we can be ordered to investigate. The person still would have to meet the criteria under the law. So our investigation has to come back and say that, yes, this person is persistently gravely disabled as a result of a mental health disorder, and that investigation goes back to the court where ultimately a judge would make that decision, and a different judge, different court.
Yeah, the judges over guardianship. So for Care Court, we went over everyone that can apply, the ways that people get involved with Care Court. So is Care Court essentially a way to help direct people with a severe mental illness that could possibly be a grave danger to themselves, an attempt to get them on a treatment plan to kind of help them get back on track?
I think that's a fair characterization. I think the goal is to get people connected to care. The goal is to hold, there's 58 counties, as I'm sure you well know, and varying levels of behavioral health services across those counties. So part of the goal is to hold county behavioral health departments responsible to see high needs people. I think that's fair to say those are the two big goals, to get people into care and make sure that behavioral health departments are doing their their utmost to outreach to people who need those services.
Okay, and I know you said there's about 17 petitions so far. So are you guys seeing a wide intake of just cases coming? I know everything just started in October, but are you guys already backed up, or are you able to divert them pretty early through the risk assessment that you guys are able to do over the phone?
We've had a lot of diversion, and I think we have not seen as many calls as we thought we might. Certainly there was some perception that there's going to be hundreds and thousands of calls. I think part of the public information campaign that went out early was to dispel these common myths, to say, again, not everyone that's homeless that qualifies. People who have a substance use disorder that alone doesn't qualify you. You have to have the schizophrenia diagnosis. There's not involuntary medication. We cannot lock somebody up against their will. So I think some of the early perceptions were that, like, oh my goodness, this is the silver bullet. We're going to file on every single person in our city that's homeless. That has not materialized. So it's been a relatively low number of calls that we have been able to keep up with.
Thank you.
Yeah.
Anybody else from the dais? Well, thank you very much. And that, you're right, that did clear up a lot for us and whomever is watching. Plus, this PowerPoint will be with Brian. So thank you very much.
Yep. Thank you for the opportunity.
Thank you, council members, Mayor Pro Tem. That concludes the homeless item for tonight under A1. I would just like to add, with the partnership and collaboration with RUHS and them joining the Homeless Task Force, we are looking at updating our homeless landing page, our website, with some additional information, and we'll be working with them to ensure that some of this information will also be available, or at least links to their pages will be available.
Okay, thank you. Okay, so that concludes topic item number 1 on our study session. Before we move into the next study session topic, which is the Parks and Community Services, Library Services, and after-school programs, I'd like to ask the dais if you guys would mind giving 9 minutes of our time. I think, how many speakers came in, Ms. Jane?
Just one.
Okay, 3 minutes of our time.
2. 3.
Dear Lord.
Yes.
Well, it's up to them. I can't.
No, I'm saying yes too. I don't mind. I'm not saying that they.
Yeah, we can't hold them against their will.
Okay, so any objections to allowing 3 speakers through their 3 minutes each? I don't want to set precedent. Obviously, I'm not the mayor, but I don't want to set precedent for future meetings. But I know there was something else going on in the city tonight where these 3 individuals probably went and spoke, but they want to talk to you guys and address the homeless issue if you guys so wish. No objections from the dais?
No objections.
Ms. Jane, can we get the speakers, please?
Okay, I've got one speaker card for Roy Bleckard.
Okay, so remember, speakers, that this is on the agenda only. The topics of homeless services update and library services and after-school programs. So take it away, Ms. Jane, or city clerk, sorry.
I hesitate to come up here after hearing the care court qualifications because I'm almost certain you have the paperwork filled out that I have a severe mental illness, and we'll figure out, oh, that way we can get rid of him. I say that, and hopefully with the email I sent you about 3 o'clock, of this whole thing. Because then I wrote on my speaker slip, we'll see if free speech is still alive. First place, this is how it should go. Public comment should come after the presentation, because how in the hell would we know what we're talking about? Second thing is, you don't post the PDFs of these presentations like we did. You know how that got started? In 2014, right upstairs in a public safety meeting, I said to Tom Owings, how are we supposed to comment on this stuff? You hand us a big stack of paperwork, 10 minutes, and we're supposed to do it. He looked at Tom DeSantis, who was assistant CM at that time, and said, you know, can we do that? And he said, yeah, in the next meeting it was done. Why are we getting away from that? Because you don't want to hear. You don't even know how to run a meeting.
For homeless services
And this is what we're talking about, because this is the idea of what we're talking about and how this stuff goes and how these presentations should be made. That's an agenda item. Refresh yourself with the Brown Act. I can talk on anything on the agenda item and anything that pertains to it. So let's get this straight, and I'm exactly saying what's going on. Our leaders, our staff, everybody here, 98.7% of the time does not know how to run these meetings. This is the way it should have been set up. Should have been set up before, after public comment should come after the staff presentation.
Roy, our guests are here to hear about this.
Yes.
You guys asked them to wait, so they're waiting.
Yes. And that's what that's what I want them to hear. So they have their staff presentation ready to go and posted with the agenda 72 hours before or whatever the meeting is. So that's what we're talking about. How do we comment on this stuff and like the homeless? I will say this, Fred has been on this homeless stuff like white on rice. And again, he probably wouldn't have got a chance to comment of how we get this stuff done. This is what I'm talking about. The whole process needs to be reviewed. This staff, this council needs to work on that.
Thank you. Next speaker, please. Steve, you have some comments?
I just have a comment about the Brown Act. So the Brown Act provides that the public is entitled to speak on any item at or prior to the time that the item is brought up for discussion.
At or prior to.
Yeah.
Thank you. Ms. Jane, next speaker, please.
Okay, Fred Bunuelo, followed by Bob Palomares.
I want to thank you for allowing me to speak, first off the bat. I live by Lakeside Plaza, Iris, and LaSalle. There's a constant, in my experience, it's not getting resolved. I want to thank the Salvation Army, because you guys have been out there twice when I've called, and you come out, but the problem is that these people don't want help. And I don't know what I heard. I mean, I got here late because of the other meeting, but I'm trying to work with everybody to get that issue cleared up with the property management. If you guys seen me, I came here with the Planning Commission because the dispensary promised that they would help patrol with the parking lot. Well, they're not doing that. And all that really is going to do is, yes, it's going to get that issue out of the way, but they're just going to push them somewhere else. I don't like to call up the police department because that's tying up resources. I need people to figure out what we're going to do about this issue to help these people who don't want help. That's the issue. And one of the things that I experienced when I went on a ride along is I'd like to see the deputies. I have a little book. I carry it with me. When I feel safe to talk to somebody that it brings up a conversation with being homeless, I'm going to give them this local resource guide. I would like to see all the deputies have this, that if they encounter somebody, please give it to them. Let the deputies have resources that can help these people that want the help. I just get very, frustrated that we live in California and the people that we got, elected, it turns this way. And everybody that's listening, we got to figure out a way to help these people. Don't tie up the deputies. We need a team. Like right now, the other night I called, there was 3 homeless people. One of them was sleeping in front of Stater Brothers. Another one was setting up camp behind Starbucks. They're regulars. And, I'm sure the dispatch is getting tired of me calling. They know who I am. Something has to be done. And I hope that everybody here will collaborate, whether it's property management, whether it's the sheriff's department, whether it's you guys that are wanting to help out. We need to get something done. Let us be the city that's going to show everybody else how it's done. We need to figure it out. It's going to be tough, but we need to figure it out. It just gets frustrating. My wife, she doesn't feel safe. There's a gentleman that's there that is like speaking gibberish. Everybody knows who he is. I even think he has a home, but he needs the help, and we got to figure out a way to help him. Situations recently where homeless people attacked a lady. I'm sorry, I only have 15 seconds, but we got to figure a way to get this done. Thank you for allowing me to speak.
The final speaker is Bob Palomares.
Before Bob goes up, Brian, just to real quick, clarify, is it illegal to be homeless?
Mayor Pro Tem, council members, as discussed during the presentation and my previous presentation at the study session in February, in the state of California, it is not illegal to be homeless. And quite frankly, in many cases, homeless have more rights than other individuals. And so when it comes to homelessness and whether or not the law enforcement can do anything, it's dependent on whether or not there's an act of violence or a crime that's actually committed, because it is not illegal to be homeless in the state of California. So in very limited cases can we even move a homeless individual. It's even tougher when it's on private property. So what the gentleman who is describing these various scenarios and hit various calls and who he's trying to work with, unfortunately, that's the society that we live in nowadays in California, and he's doing everything the right way, documentation, contacting and collaborating. But again, it is very difficult in the state of California to tackle the homeless situation.
Thank you.
Good evening, Council. I've been waiting for this to take effect for a long time, reading a few years back on it, that it was going to be coming and coming. And you can't believe everything you read in the Press Enterprise, because I have read, and I believe they had stated that when somebody got into the program, the judge could order them for up to 2 years to stay in that program, And listening to this gentleman, where I believe, yeah, it's true, you can't make anyone do anything. But there we are. And I hope down the road this program widens, where we include maybe individuals that aren't qualifying for this court cure, maybe in another way, and that'll probably be like housing and things that the council has spoken about in the past to deal with homelessness, because we're going to take care of some people here, but we're still going to see people on the street, and we're going to wondering, is it working or not? And that's my concern, because I know the Sheriff's Department does a tremendous job, trying to control them and see who's who and where they are, and they do a good job, because I've noticed the difference. But I hope this thing can widen, or maybe the city do their part in a more way where, how could I say, not what court cure is doing, but, just approach them more in a different way. And, I know we use the Salvation Army and they're good, but I think there's still something missing, to help these individuals, because, like I said, only a few of them are going to fit into the program, and the rest of them are still going to be in the streets. And what do we do with them? And I know it's a long road and it's going to take a lot, but I think we need to be a little bit more aggressive on the city's part. Thank you.
Thank you, Bob.
That concludes public comment, Mayor Pro Tem.
Okay, we'll move on to topic number 2, Parks and Community Services, Library Services, and After-School Programs, and the report will be given by Parks and Community Services. And thank you, guys.
Good evening, Mayor Pro Tem and council members. I will do my best to quickly go through my presentation, but I did want to talk about our Library Services and After-School Program. Again, I'm Patty Ewe with the PCS Department, Admin and Financial Services Division Manager. Before I get started on those programs, just wanted to provide a brief overview of what our new division does in Parks and Community Services. We have fiscal oversight of our $42 million budget, which includes our operating budget, capital improvement projects, and grant funding budget of $10 million. We also manage department contracts, agreements, purchase orders, invoices, and vendors. We have also been tasked with seeking grant opportunities, coordinating the submittal of the application packets to bring some of those programs over to Moreno Valley. including grant reporting, tracking, monitoring, and audit request support as well. We administer our ActiveNet activity registration system and coordinate marketing and sponsorship plans, including the Beautify Moval program. We also provide administrative support to our various boards, commissions, and committees, and serve on a number of nonprofit and clergy roundtable and district task force as well. This division also oversees the library operations and after-school grant-funded programs, which I'm going to talk about in the next few slides. First, the Moreno Valley Library Program. The total operating budget for the library this year is about $3.2 million. Main revenue source comes from property tax library, which is $2.3 million. We have other revenue sources, including some tax redevelopment redistribution funds, library fees, fines, and donations. And the general fund does subsidize the program for $175,000 per year to cover any anticipated deficits in the year. Some of our expenditures, main expenditures, is our contract services for library operations, library materials, and our rental space of the satellite locations. Library grants, we have approximately $130,000 this year in both state and federal funding. Most recently awarded was our City of Moval, we're calling it Moval Gamers Layer, and that's $69,000 from California State Library. That's through the LSTA grant. And that's going to provide a technology center at the Moreno Valley Mall Library branch with gaming stations, 3D printers, robotics kits, and a lot more. So we're really looking forward to setting up that technology center over at that branch. We also have our Zip Book grants from LSTA, which provides books delivered to homes via ebooks. We had over 344 requests last year. And our Anytime Storytime, which are home kits available for checkout that parents can take home and focus on some of the STEM activities that are there. They're all themed, and they have books that they can read along with those activities, and they can check out those kits and then bring them back. Additionally, our program counts with 3 library branches. We have our main library branch over on Alessandro, our Iris Plaza satellite branch, and our Moreno Valley branch, with the new satellite library branch coming soon. Again, our service provider is Library Systems and Services, LS&S. They provide full library operations at our 3 sites, including staffing for those sites as well. Maria Sunio is our library director, and you see there the other managers, Lena and Christina. And these are some examples of our programs. We have over 900 programs offered annually, including ABCs and 1, 2, 3s, bilingual story times, Game On, Next Gen. Anything from toddlers to seniors, we provide services for them. We average about 15,000 participants per year, and half of those are youth. PC Sessions is very popular, and we offer about 25,000 per year on that. Over 270,000 annual visitors this past fiscal year, and that's all 3 locations combined. So libraries widely utilized. One of our first after-school programs I wanted to talk about is our Child's Place after-school license program. This program is budgeted at $1.2 million. The monies come from the California Department of Social Services. Our maximum contract award this year is $917,000. We also received over $278,000 in stipend funds coming from ARPA and CARES funding, and these are one-time funding that will help improve some of our sites, which we have done some repairs, bringing in some new AC units and so forth. So a lot of that funding has been going to support that. $30,000 is from the Federal Child and Adult Care Food Program, and we operate at 4 sites: Armada Elementary, Creekside, Rainbow Ridge, and Sunnymead. And we serve approximately 122 students each day between the 4 sites. Our program components include a snack, homework assistance, STEM-focused enrichment, and recreation activities. The next program is our after-school Education and Safety and 21st Century Community Learning Center grants. These grants, the first one, ACES, is $9.3 million. That includes $7 million coming from the California Department of Education, and in-kind contributions of $2.3 million provided mainly by our partner, Think Together. 21st Century grant, we get about $46,000 per year, and that's for summer programming at one of our sites, Edgemont Elementary. The city did also receive ESSER funds this year in the amount of $60,000, and that's to expand that program over at Edgemont. So we're looking forward to providing additional services there during the intersession, summer times that the school is not in session. Again, Think Together is our partner and service provider. We have 43 school sites that we currently serve with our ACES grant funding, and that's both in Moreno Valley Unified and Valverde Unified School Districts. We serve approximately 90 to 100 students daily with the various components, including literacy, math, enrichment, and physical activity. And with us this evening is Harlan Santos, General Manager with Think Together. And I just wanted to leave you with that quote there. And Harlan will talk a little bit more about Think Together.
Good evening, everyone. I want to thank our city council members as well as the city manager, assistant city manager, and directors for allowing us to partner with the city so that we're able to provide services to our students in Moreno Valley Unified and Valverde Unified. So with Think Together, we're partnering with the city of Moreno Valley to change that for kids. We educate the students so that they're college and career ready. That's really our focus. That's our goal, so that the students that start our programs from TK all the way to high school are ready for the real world. The students are empowered to develop their talents and abilities. And the picture, you can see the students of the month for Moreno Elementary. And really, because our goal is so that we can help the students build their skills, their leadership, so that they can be the leaders of tomorrow. With that, through the after-school education and safety program, we engage the students from the end of the school day till 6 p.m. every day, from Monday through Friday, 180 school days. The students partake in enrichment, academics, and physical components. During enrichment, the students participate in Inventor Adventure, Bugs and Pollination, design thinking. They participate in arts, cooking, drawing, esports. They also do physical activities through different components and different pieces that we call Fulcrum, which is the coordinated approach to team building exercises, and also through Catch, which is our coordinated approach for healthy living. And we really inspire the students so that they can learn through physical activities and so that they can team build. During summer, we also engage our students in field trips and extracurricular activities, and we also engage them in fun events, such as learning about Hawaii, seeing a pollination dance, things of that matter. As Patty had mentioned, we are serving in Moreno Valley at 27 schools, and we're serving at 16 schools in Valverde Unified. We're serving over 4,000 students every day across both districts. So that is a lot of impact that through the city of Moreno Valley we are making in the community. We are also employing 240 community members from Moreno Valley to be able to deliver those services. So it's our community members serving our students who are growing up to be the leaders of this generation. And with that, we're just excited to be able to partner up with you to be able to deliver the services. Thank you.
Awesome. That's great. Thank you. Any questions from the dais? Thank you. Is that a wrap for you guys?
Yeah. Yes, it is. Thank you so much for listening.
Great job.
Thank you.
We appreciate it. So I think that's it. Any other questions or comments before we adjourn? There being no further business, the study session is now adjourned at 7:42 p.m.